A major cause of Alzheimer's disease. Now, there's more than one thing that can lead to Alzheimer's disease, but in this video, I want to talk about the biggest one. It all started in 1901 when 51-year-old Augusta was sent to an insane asylum. And that was because she was described as a 51-year-old delusional, forgetful, disoriented, anxious, suspicious, unruly, and a disruptive woman who could not carry out her homemaking duties. Do you know the doctor who evaluated her in the insane asylum? Guess what his name was? Dr. Alzheimer. And he evaluated her, and then later she died, and they did an autopsy and looked at her brain. And they found tangled fibrils in place of neurons. So the neurons are the nerves that make the brain function, and they were being filled up with these tangles. Here's a normal neuron. There's the tangles inside the neuron. And amyloid plaque is another thing that is a sign of Alzheimer's disease. I want to talk about one of the biggest factors, and that is atherosclerosis. It is a significant factor. Now, when you have hardening of the arteries in your heart, you can develop heart disease. But when you have hardening of the arteries in one part of the body, you got to suspect that it's going on all over the body, and it is. And the brain is the most sensitive of all organs to decreased blood flow. And when you get decreased blood flow, it leads to decreased brain function. And decreased brain function, one of the things that can happen is Alzheimer's. So do these Alzheimer's patients end up having more atherosclerosis than other patients? They have significantly more. So this is what a normal artery looks like in the brain. That's what they should look like. This is what Alzheimer's arteries look like. Do you think that's going to affect the function of the brain? Your brain requires a lot of blood flow. In fact, 1 quart per minute. Just think about that. 1 quart of blood per minute is supposed to go through the brain. But that's not possible if these arteries have narrowed. And we all have narrowing of our arteries as we get older to some degree. This is what happens as we age. But look what happens in Alzheimer's arteries. Significantly more. Some say that Alzheimer's disease should be labeled a vascular disorder. If you look at patients with Alzheimer's or patients with dementia, the more atherosclerosis they have, the more dementia people have. An insufficient blood flow to the brain has very grave consequences on brain function. Those with vascular risk factors that have been treated decline less as they get older than those who are untreated. So people with Alzheimer's should absolutely have their risk factors evaluated and be treated. So is it possible to reverse arterial disease? Is it possible to open up these arteries that have been narrowed? Now my classes here, they're shaking their heads. Yes, it is possible, and we've known this for a long time. In fact, in 1992, they started doing imaging studies showing that the small blood vessels could be opened back up, some of that plaque removed. And how long did this take? 3 weeks to begin to see those changes. And they were placed on a very healthy, whole food, plant-based nutrition diet. You can see even in the larger arteries, they can be changed and opened up. So this absolutely is possible. And I've helped people do this for decades now. One of my first patients was Roy. He had a blocked coronary artery. His surgeon wanted to do a bypass on him. And he was in bad shape. He was obese, he had a terrible diet. He couldn't walk a block without having to sit down, and he was on nitroglycerin for chest pain. but he followed my program exclusively. And 1 year later, he went from not being able to walk a block to elk hunting in Colorado, hiking the mountains for a week with his grandson. When he came back, his cardiologist insisted that he have the angiogram done again and was amazed to see that the artery opened up similar to this. And this is actually a picture of me and Roy 28 years after that happened. If you want to prevent Alzheimer's disease, your delivery system has to be working correctly, your heart and your blood vessels. So I want to encourage you to fix your delivery system. And that's just one of the 7 systems that we help you understand in the 7 Systems Plan online course. There's actually at least 31 different factors in Alzheimer's. Just a few of them. If you have a fast resting pulse, that's not a good sign. It shouldn't be above 65. If you're on statin medications, there's more of a risk for dementia. If you have hypertension or you're on blood pressure medications, that's a risk factor. Heart disease absolutely is, diabetes is. And for more information on fixing your delivery system and keeping your brain functioning normal, check out the online course at 7systemsplan.com. All right, so now you know how important this system is that we're going through, the delivery system. So we are on lesson 1B. 1B. Yes. Hello. Say it again.
Look at your screen. The delivery system is half cut off. Is it not on yours?
No. Yeah, our computer's normal. Oh, you mean at the top? It is a little bit on the top one, back on this one. Okay, thank you. I'll get that fixed. Camera got bumped a little. That's better. All right, 1B. Hi. Yes. Okay. All right.
Everything okay?
Can you plug this in and plug my computer in up there? That power strip wasn't on when I was in that room.
push this over, it's not gonna reach. Push your laptop over a little. What is this white here? What is this? Do you know?
That's probably power the whole thing.
Otherwise I'll go get another
I think this will
power.
work.
I could go get another cord. I have that orange cord. The one we have,
I think this will work.
it's not
Okay.
stretching. That's stretching.
That's right, I won't need it.
You
for
sure?
now. Yep.
Okay. Can you tell if it's charging?
Yeah, it should be.
So make sure I got it in.
Yeah, we're in. We're charging.
Okay.
Welcome to the delivery system. This is lesson 1B, and I'm going to help you understand diabetes. We're going to give you 7 things to treat your diabetes, to decrease your risk, and it's 7 things that you should be doing anyway, even if you're not a diabetic. And then we're going to talk about GLP-1, and you guys have all heard that in the news, the weight loss hormone. And I want you to make your body produce GLP-1. I don't want you getting injections. As we get started, here is a salad. Now you notice I kind of went heavy on the onions, maybe a little too heavy. Well, onions are very good for you. There's olives in there, there's some organic beef, and what is this? Asparagus. Asparagus, very good for you, and lots of greens, and that's one of the things we're going to talk about. Diabetes is an epidemic in America. I'll show you some figures in just a little bit. But there are 3 main causes of diabetes. A poor diet, number 1. The biggest thing for diabetes is a poor diet. Extra weight, a big problem, and inactivity. So those are 3 of the things that we want to address. And I want you to know there is hope if you're a diabetic. This is Andy, went through our program last year. Diabetes and medications, multiple meds, and about 10 months later, 100 pounds gone, and all of his meds gone, and no more diabetes. Mike lost his diabetes in 90 days. Another patient, Sharon, lost her diabetes, and she didn't even know she was a diabetic when she came to our office, and that's not uncommon. And we help people with type 1 diabetes as well. This is Lucinda, out of control type 1 diabetes. Her hemoglobin A1C was 11, and she was miserable on lots of insulin. We were able to cut her insulin requirements down by 2/3 and get her feeling great again and lower her A1C significantly. 1 in 3 children born today will be a diabetic, and that's a scary number. Diabetes is a very expensive disease to have, and half of all Americans, if you can believe that, are diabetics or pre-diabetics. So let's start off with a song from the Hilltop Singers. I told you in our last lesson we were going to do this, and you guys are going to remember this.
I'd like to buy the world a home and furnish it with